Hi, this is Josh. I'm from pharmacisttips.com. Here today to talk a little bit about the Medicare drug plan, or the basics of Part D drug coverage. First, what is Part D? It's an optional prescription drug coverage available through Medicare. It covers medications, of course. It covers some insulin supplies and certain vaccines. It is just prescription medications. It does not cover over-the-counter medications. It does not cover test strips and insulin pump supplies. Those go to Part B as in boy. What are some of the costs of Medicare drug coverage? Well, there's your premium. That's your monthly premium. You can contact your plan and have that taken out of your Social Security check. There's a deductible. Oftentimes, this is only applied to brand name medications. In 2018, many of the deductibles are around $400 every year. There's the copayments. The copayments, that's what you pay at the pharmacy when you go to pick up your medication. Once you hit the coverage gap, you're going to have to pay more for your medicines, or the donut hole will go over that a little bit more. And then there's a late enrollment penalty. The late enrollment penalty is charged if you do not sign up for Medicare Part D or the drug coverage when you're first eligible. And so that adds each year that you don't enroll, and that would be included in your monthly premium. So open enrollment for Medicare drug plans is October 15th to December 7th each year. You should check every year. You could really save a lot of money if you switch to a plan. Even if you're happy with your current plan, it really is worth checking each year. I've seen people, they were happy with their plan, so they didn't make any changes. Roll around to January 1st and they find out the pharmacy they've been going to is no longer preferred on the plan, or the cost of medicines have gone up. So it really is worth your time to make sure your plan is going to provide you the same coverage the following year. And the formularies may change. They may no longer cover your medication. So it is worth taking that little bit of effort just to make sure that your coverage will be the same for the following year. The donut hole, or the coverage gap, is another source of frustration and confusion for a lot of folks. What it is, it's a limit on the drug coverage. In 2018, it's when you and your plan have spent almost $3,800. That includes deductibles, co-pays, and then the portion that the insurance pays to the pharmacy. It, however, does not include your monthly premium. It doesn't include the pharmacy dispensing fee or medications that you pay cash for. You should get an explanation of benefits each month that will break down some of those costs to you and help you determine that. So the cost of medications in the coverage gap varies by year. In 2018, you're going to pay 35% of brand, 44% of generic. So that's 35% of that copay plus what the insurance pays. You add that together, 35% for your brand names, 44% for your generics. And each year that's going to get smaller out of pocket for you. So in 2019, we're looking at 25% for brand, 37% for generic. And by 2020, 25% of both. So that's 25% of your copay plus what the insurance pays. That's what you'll pay during that coverage gap, or the donut hole. And then once you've spent $5,000 out of pocket, your copays will go down. You'll just have very small copays for your medications. What are some ways that you can reduce the cost, maybe even prevent yourself from getting into the donut hole or the coverage gap? You want to use generics whenever possible. Of course, that's a discussion you need to have with your provider. Make sure your doctor is on board with that. There are many suitable generics out there anymore. A lot of folks can switch to generics. The manufacturers sometimes offer assistance programs when people are in the coverage gap. You can apply for extra help if you qualify. It's income based, and you can buy over-the-counter medications. Certain medications used for stomach acid reduction and allergies are now available over the counter, and the cost of those wouldn't push you closer to the coverage gap and may reduce your costs. Again, that'd be a chat you'd want to have with your doctor. Make sure they're suitable to treat your condition. So what's a prior authorization, which we see a lot? If your doctor prescribes something not normally covered by your insurance, it's something not on their formulary. Their formulary is just a list of the medications that are preferred by your plan, a list of the medications that they cover. And if it's not on there, it may require prior authorization. It also may require something called step therapy. Step therapy just means for this condition, there are generics available that they'd like you to try first. And if you fail those, then your physician can fill out some paperwork, let them know that you've failed those other medications, and then your insurance will most likely cover the more expensive medications. Certain doses, higher than normal doses, require prior authorization. There are a lot of medicines that are not covered. Benzodiazepines, medications like Valium, Xanax, Klonopin, those things are not covered by many plans. Most cough syrups are not covered by the Medicare drug plans. Of course, vitamins over the counter, not covered. Even some of the prescription higher dose vitamin D, not covered. Medications for hair growth, erectile dysfunction, fertility drugs, weight loss drugs are not covered. There also may be certain yearly limits. Many sleeping medications like Ambien are often limited to 90 days per calendar year on plans. And of course, there's going to be other plans have certain limitations. So that'll be something you want to consider as you're signing up for your drug plan. Extra help is available to those people who are on lower income. It can help cover premiums and deductibles and other costs. It is based on income. You can go to the Medicare website or your local Social Security office, and they can help you determine whether you're eligible for that extra help. And of course, you can contact Medicare 24 hours a day at 1-800-MEDICARE, or go to their website. Their website's very easy to use. I do thank you for watching. I hope I helped clarify a little bit about Medicare Part D. You can ask questions in the comments. I will respond. Or you can contact Medicare or your prescription plan directly. If you found this information useful, I'd really appreciate it if you subscribe to my channel. And I do have a summary of some of this information at pharmacisttips.com/medD. Thank you for watching.